let's talk about prevention, really. So it's about encouraging and maintaining health and wellness. Oh, what do you mean, Tracy? That health and wellness has been a popular term. Yes, prevention is about encouraging and maintaining a health and wellness strategy. So it can be prevention for physical health, behavioral health, all kinds of areas. So prevention is about being the best person that you can. That, as you look at yourself, how can I improve myself and become that best person both now, and ultimately in the future. And also prevention is really about preventing, and delaying. So preventing and delaying that onset of negative issues and behaviors and negative consequences and outcomes. So when you know you're doing good prevention, you can really keep it from happening, or you can delay it from happening in negative consequence, and then avoid those negative consequences and negative behavior. Questions? Okay, so what we know is this, that no matter how you see it, prevention is always across the lifespan. You can do prevention for a toddler, it's like you can do a prevention for seniors, okay? So we can go from infants, and here's some examples. If you don't know what FASD means, it means fetal alcohol spectrum disorder, fetal alcohol spectrum disorder. So you can do prevention to prevent the fetal alcohol and the effects of maternal substance use, all the way to older adults, as you see on the bottom of the screen, that we can just teach how we can prevent prescription drug misuse, right? So prevention goes across. Many times we want to think, oh, it's just for the adolescents, or it's just for early young folks, but it's also for college age and adults and older adults and infants. So it runs the lifespan of the work that we believe in. Also, in fact, what I wanted you to know is what is ineffective prevention. A lot of times we want to do these things, and we think it's popular, but it's not an effective prevention strategy. Take a look at those 4 bullets. Which one surprises you the most that it is not a prevention strategy? Put in the chat or unmute your mic.
The motivational speakers surprises me. The cautionary doesn't surprise me, but the motivational surprises me.
Okay, and let me see here. I got it. And why do you say that?
I think we've had. I work in the overdose fatality review work, and we have had some large events that counties have led that are led by people in recovery that tell their story. And families and folks that are present have found that to be, inspiring and hopeful, but that might not be what's meant by that bullet point either.
It is meant by that. But I will tell you that any of these that you see here by themselves are ineffective prevention. So if a school wants to have a speaker come in of young folks that just talk about substance use and that how it hurt them and how it did something to them. And remember, the unique thing when we get to the behavioral health continuum, I'm going to tell you why it's important. But if you want to be effective, multiply in a multiplier effect way. In other words, not just one child, not just one in person, but multiple folks. You want to affect a broader population. And that's the strength of good what we call environmental prevention. So if a school had a speaker come in and actually just said, okay, we're going to talk about drunk driving, but during the year there is no programs in the school setting that was using evidence-based strategies or curriculum that led up to that one thing, then that by itself is not effective. That's what that's saying to, is that the research has shown doing these things all alone as a way to say, well, this is what we're going to do for prom. But if you don't have anything that leads to that, dealing with that behavior ahead of time using an evidence-based curriculum or an evidence-based strategy or continual process, but just do it by themselves, scare tactics, those kind of things, they don't work. They really don't work. There hasn't been any third-party evaluation that's shown those by themselves as effective in a broad-based population. We knew that the situation in the 50s and the 60s was, and still today, look at that, heroin, psychedelics, drugs, that was a major, major issue for a smaller country in the 50s and 60s. And so look what they did as prevention strategies, you all. What I just told you earlier was not effective, right? Look what they did with heroin. They tried to do scare tactics. They did do education, but they tried to do scare tactics through films. And that's the only way they did education, was through film. So if you couldn't afford to go to a movie theater, guess what? You weren't getting the education, right? Or if you were trying to get scare tactics and that was supposed to prevent you from using heroin in the 50s, then it wasn't at all very successful. And look at the 60s. We were using those sort of those psychedelic drugs, those LSDs and all that stuff. And the only prevention strategy that our lead government was focusing in on was, let's scare the heck out of them. If you use this is gonna make you so crazy, you ain't gonna know what to do. So let's just scare them, okay? That became the historical way of prevention in those 2 decades, okay? In the 70s, the 80s, it was, you know what, we can't scare them, so let's offer alternatives, things that folks can do, maybe some athletic stuff or some ways of doing things separate than just always wanting to have idle time on their hands. Let's offer them something else. Let's move them into another direction. And even what we started seeing, one of the president's wives was saying, just say no. That was prevention back then in the 80s. I think President Ronald Reagan's wife, Nancy Reagan, if you ever get a chance to Google the Just Say No program, that was a huge, major, using taxpayer dollars to really look at that piece. But you know, for the first time though, for the 70s and 80s, y'all, alternatives was that first step in moving in the right direction, okay? But the Just Say No program brought it back to a swing again, because just saying no is not an effective program. It can have no effect on communities, on individuals, on broader communities, okay? We also know that in the 90s, there was an increasing emphasis on, hey, you know, let's just don't do one prevention approach. Let's do a comprehensive prevention approach. And this was the time when I was just starting, that let's look at some of the approaches I'm about to show you all in a few minutes. Let's do more of a comprehensive stuff. Let's study Tracy's himself. Let's study his friends, the neighborhood he lives in. Let's study the family that they're coming from. Let's study that whole community in which that might need a broad-based environmental prevention strategy, okay? And saying, you know, if we can attack it multiple ways in a comprehensive way, and then just using one tool, we have multiple tools that we can use. That's good prevention. So now the research was coming towards saying using multiple strategies over time can have an effect. And that was early research was starting to show that that's a true methodology. And then what came was this whole idea in the 2000s, and as of late, the 2010s, and as we move into the 2020s, now that we needed to understand this whole connection between substance abuse and misuse and what else? mental health. And that's when I went to work at SAMHSA in 2005 and 2006, moving away from, we kept the comprehensive idea, right? But also we knew that mental health was important because it allowed Tracy, as an example, to make a decision if he's feeling good about himself. If he's dealing with anger, if he's dealing with anxiety, if he's dealing with depression, early depressional signs, chances are Tracy may decide to be influenced to use some sort of substance to sort of blend and soften the blow of his or her mental health issues of anger, anxiety, or depression. Another thing I wanted to talk to you about is that another entity of your tax dollars that work every day towards you. Now, the only reason I can tell you about the Institute of Medicine is that many of us learned about the Institute of Medicine because of COVID. And there was a short little guy named Dr. Fauci. I don't know if y'all remember him during COVID, but he came from the Institute of Medicine. There's a National Institute of Health. And then within each National Institute of Health, there's several institutes under the National Institute of Health. Your government work, your dollars at work. Well, they created what you see in front of you at the screen, something called the Behavioral Health Continuum of Care. And so what they said was, for the first time, let's lay this out from a full continuum so each entity of the continuum understands that they collectively, key word, they collectively need to work together, okay? So on the far left side, well, let's start at the bottom. There's always promotion and promoting each other's projects collectively. Promotion meaning promoting mental and behavioral health. Why it's important to do health and wellness, to live healthy, to do healthy things, to be healthy. Promotion of mental and behavioral health is critical. But also we know that prevention is also important. And look at what the three key areas of prevention there is. There's universal, right? That's for everybody. There's selective. That's for folks who are who are living in high risk. Remember those risks that I showed y'all earlier? Living in some of those risky kind of environments or risky in any of those domains of risk that I showed you. That selective group haven't done anything yet, but they live in those and are connected to those risks. And then there's those indicated who already have had family members or others in their lives have been focusing on that negative behavior and have had that in their lives already directly, or they themselves have been involved with the beginning aspects of it. Okay, so that's what Institute of Medicine says now replaces primary, secondary, tertiary prevention. These now are the prevention that the Institute of Medicine has identified as critical and important prevention pieces. Connected to prevention is treatment. Treatment of substance use, treatment of any kind of negative behavior, treatment of whatever you need, because it's case identification, whatever my individual issue is, which needs treatment, and what are the standard treatments that I am going to get because you've identified what my case is. And at that point can begin the whole aspect of what one would call recovery or maintenance. Sometimes we need long-term treatment care, recovery, or we need aftercare and rehabilitation. But the Institute of Medicine created this continuum to show us that we're all connected, that treatment organizations, recovery organizations, and prevention organizations, along with promotional behavioral health and wellness organizations, have to understand they're all part of this full continuum. And no matter where we find people within this continuum, That's how we identify the strategies of good prevention or good treatment or good recovery work, because it's all behavioral health. One of the good things about good prevention is that we can do programmatic prevention, 55 kids, 100 kids, that's prevention. But if we're going to do, if we go back to this slide here, and we need to do coalition work, y'all see my arrow? Most coalition work takes place right here in promotion and universal prevention. This is where your coalition work is the strongest, okay? And so in order to know that, you have to create a coalition, which is what I'm telling you all, that is, you got to be connected with other folks to really impact this right here. There has to be some sort of coalition. That means, but I know in Milwaukee it don't happen. Other cities it might. There may be some turf issues. There may be some isms and schisms that exist. I know not Milwaukee, because I know y'all doing the doggone thing. But in some communities, in order to impact this continuum, you have to be able to collectively work together as a coalition. Okay? Because you bring independent organization thoughts and processes to the table. But ultimately, the idea is to really take the resources and make, as it says in that definition, specific change, right? We know that local problems require local solutions. There is no way, you all, that if you're only impacting one thing and you think that that's a real impact without bringing together all these others after we talked about the importance of the domains, good communities focus on building collective collaborations. I didn't say collaborations and beat each other up. I said collaborations, collaborate, working together, okay? And here are some, what we know in good research about coalitions. If you have these minimal 12 sectors in a coalition, you increase the chances of doing good environmental, broad-based, universal prevention and promotion in your community. In your community. So what's the difference between if I had my own prevention program or if I had that broad-based good group of people behind me and we're all working together? Well, if I had a program, I'd be just responsible for the participants. If I had a coalition though, our responsibility is for all of us working together as a community. If I was just a program, I just focused on individual risk factors and individual protective factors. But if I was a coalition, I would focus on those environmental factors that impact a broad base of people. If I was a prevention program, I'd probably just target outcomes for just the people, the 30 to 50 people that come to my organization that I'm doing prevention for. But if I was a coalition, I target those 50 plus that whole community in which those 50 live. And looking at what? Community level outcomes. Changes in knowledge, changes in attitude, changes in behavior. Remember, outcomes is that, okay? If I was a good prevention program, I'd probably be limited in activity that could address anything related to, maybe I need a policy change, maybe I need the city to open up the parks more later, or maybe if I was just my own prevention program, I probably couldn't impact that change just as one organization. But if I had a coalition, I could see the ability of really making that change happen and making policy change take place. But I will tell you what a coalition is not. A coalition is not just one organization. No way. Can't be. A coalition is not just one prevention program. That's not a coalition. A coalition is not externally run or externally driven by other organizations and everybody just sitting back and letting it happen. That's not a coalition. It's not an automatic link though to grassroots either. So coalitions are not that automatic link to those great grassroots communities that I know exist in the city of Milwaukee. That I know in the county of Milwaukee. So it's not that automatic link to those great grassroots. Okay. I also know it's not a quick fix. It's not a quick fix to this. No quick fix. In other words, you're not going to see quick changes happen because of that. But what they do, what coalitions do is this. They affect the entire social environment of your targeted population, okay? They also develop this whole big, broad base of support and teamwork. Because you know what they say about teamwork. What? Teamwork makes what? Yeah, I know it. The dream work. So it develops a broad base of support. And then it brings those outcomes, those results. They're long lasting.